Claudia Tuck is the director of Alachua County's Department of Community Support Services. Ms. Tuck previously served as the director of the Palm Beach County Division of Human Services and was formerly employed at the Oakwood Center of the Palm Beaches, where she was the associate director. She represents the Florida Association of Counties on the State Council on Homelessness, as well as the National Association of Counties, or NACO's, Human Services and Education Steering Committee, and serves as vice chair of the NACO Social Services Subcommittee. In 2019, Ms. Tuck was reappointed by the NACO president to membership on the Veterans and Military Services Committee. She is a board member of the National Association of County Human Services Administrators and was elected to the position of vice president in early 2018. She is a past president of the Florida Association of County Human Services Administrators, having served in all officer positions since 2007. Ms. Tuck is a current member of the National Association of Social Workers and the Academy of Certified Social Workers. She is a licensed clinical social worker and a licensed healthcare risk manager. She received a Bachelor of Arts degree in International Relations and Sociology from the University of Delaware and a Master of Social Work degree from Florida State University. Ms. Tuck has been a field instructor at Barry University for MSW students, as well as an adjunct faculty member at Palm Beach Community College. Welcome, Claudia.
Thank you so much for having me, Mark.
You've got a great resume.
Thank you.
I am so happy to be talking with you. Community Support Services is one of the departments in the county that I and my staff just love highlighting, because the work that you and your staff do is really kind of where the rubber meets the road when it comes to citizens, their needs, and helping people. So I just want to kind of go down the list division by division and give you a chance to tell folks exactly what you do and what are the services that you provide. Let's start with the Community Agency Partnership Program, or CAP. Tell me about that program.
That's the means by which the county commissioners are able to provide funding to our local nonprofits to do the important work that they take care of for us. We have that as a funding stream. For several years in the past, we had a very competitive application, and it was paper and it was pretty labor intensive. We had a town hall meeting with all the funded agencies several years ago to really get their input and hear what they had to say. And over the past 4 years, we've really tried to incorporate what they would like to see while still targeting to meet the goals of the commissioners.
So what type of agencies are eligible for applying for this grant funding?
Agencies that serve the groups of children age 6 to 18 in the areas of education and safety, seniors, disabled, homeless and housing, areas that are basic social services meeting the needs of the community. We do have a 3-year funding cycle now that the board's approved, and the application's all online. We are in the second of 3 years currently, and we currently are funding 40 programs across the county.
Approximately what was the budget, or what is the budget in this current fiscal year?
About $1.3 million.
So, there has been a suggestion in the past, sometimes citizens that don't maybe quite understand the process have confused what we're doing with CAP with charitable contributions that we're giving to these agencies. But how would you describe what we're doing with these agencies? I know our board doesn't consider it a charitable contribution.
No, it's definitely a contractual relationship where agencies respond to an RFP, request for proposal. There's a competitive process where we have independent reviewers look at the proposals and look in the realm of what the county needs and basically select on that premise. We also are expecting performance. We receive data from the agencies every 6 months with detailed on what services are provided, and we are renewing a more intense monitoring process this year where we will have a team going on site to do both fiscal and programmatic monitoring.
So these are services that the County Commission wants to offer our citizens, and this is a great way to provide it.
Absolutely, and make sure it's received.
Yeah. Speaking of grant programs, the Choices Grant is another competitive grant, and its history goes all the way back to 2004 when we had the ballot initiative for Choices Healthcare. Tell us a little bit about that and how it morphed into a grant program.
It was a surtax, and when the surtax sunset, the board created a trust, a healthcare trust, and then it became a competitive grant process for a portion of it. The other portion was set aside to the tune of $1 million for an influenza vaccine program that's administered by the health department.
Is that the school program that you're speaking of?
It is.
Yeah.
We
And I
provide
know
the
that's
funding.
had dramatic effect on.
It has. It has. It's definitely provided the vaccine more accessible for the children.
Mm-hmm. What other kinds of things is
The
the
categories
Choices?
that are funded under Choices are medical care, behavioral health care, and dental services.
Mm-hmm.
And that is a competitive grant. It is back now as the CAP program on a 3-year funding cycle, all electronic. There's a grant review panel that reviews the grant and makes recommendations for funding to the Board of County Commissioners.
And like CAP, you know, when the board identifies services that they think our citizens need, they have a choice. Do we make new departments, hire staff, reinvent the wheel? Or in some cases, do we look out there and realize that there are great nonprofits out there already doing this work, and how do we contract for services with
Absolutely,
those nonprofits?
because the infrastructure is already there. We're just
Right.
providing service dollars, which allows for expansion to the public.
Right. It sounds like good fiscal decisions are being made.
Absolutely.
Tell me about the Community Stabilization Program.
That's a program that's unique to our county, where we're able to fill a niche where there's a gap basically in services. So if some clients need additional assistance, help with applying for Social Security, we can do that through this program. We also do community events. One that's become very popular is called Happy Ween, and we are use that as a safe trick-or-treating spot and a way to get the message out of all the great social service agencies we have in the county to the parents.
That's the event that happens at Depot Park?
It
on
is. We're
Halloween?
down at Depot Park. It's in partnership with the City of Gainesville, and we have about 65 agencies that participate in that, and we typically get about 4,000 people come out.
My staff told me that you know, we do all of these very serious, very government-y Facebook posts, and the one that we did on Happy Ween was our single largest viewed post in the
Was
month of
it?
October and November.
Excellent.
Yeah.
Excellent.
It's a great event.
Well, we consider community support services the heart of the county, so
Yeah.
that's
Yeah.
great.
Yeah. The Crisis Center, I know, just recently celebrated a 50-year anniversary,
It is.
which is incredible. And I know that Marshall Knudsen was back, the original director of the Crisis Center, along with Ali Martinez, our current director. Tell us about the Crisis Center and about this incredible milestone.
The Crisis Center is unique in that, not as far as we know, no other county directly operates this service. It's one that's been near and dear to the hearts of commissioners for a very long time. Again, created 50 years ago, started as an independent crisis line, and very quickly was assumed under the county. And it's available 24 hours a day, 7 days a week, 365 days a year to respond to the needs of our citizens. Individuals can call if they're in any kind of a crisis. Depending on the need, we respond on site. We have responded to many significant accidents, to suicides. We support both individuals in crisis and the significant others who have experienced a loss. We are available also for walk-in counseling and provide the services. Significant number of volunteers. We couldn't run the Crisis Center without all the volunteers. They really are an incredible benefit for us. About 120 volunteers on a regular basis. We have practicum students from the university as well who do a lot of the counseling.
Are we tied into the National Suicide Hotlines?
We are accredited by that body, and we take up calls for them on a rotating basis. We are a backup call. We also, in the past year and a half, were awarded a grant through Lutheran Services for the mobile response teams. And that was funding that was created by the state legislature to provide support to youth age, newborn basically to 25, as a result of the Parkland shooting. So we have now targeted staff who are able to respond 24 hours a day, 7 days a week to the schools, and really spend a lot more time both with schools and families and in the community, providing support and helping individuals to, again, try and prevent any kind of a mass casualty incident.
It's really my honor that when we have a declared state of an emergency, Allie and the Crisis Center folks sort of morph into the 311 emergency rumor control hotline, and their service is fantastic. I think during Hurricane Irma, maybe it was, they handled over 11,000 calls during a few-day period.
Yeah.
And they're, for many people, they're the first line of what do I do, where do I get this, what happens if this, and it takes an enormous load off of the Emergency Operations Center, because we're not having to constantly field those phone calls. It takes an enormous load off of the 911 call center, because we handle non-emergency kind of calls through 311. So great work with that.
Yes, we have a dedicated core group of individuals that just do that.
Yeah.
They do other things with the Crisis Center, but that's part of what their mission is. And when we call on them, they respond. We come in 8 to 10 individuals who just plan on staying, because they know if it's a hurricane, they can't leave.
Right.
And they're very committed to that. And we're very fortunate. We have volunteers who've been with the Crisis Center as many as 40 years.
Speaking of committed and volunteers, let's move on to the foster grandparent program.
Okay.
You've got the coolest programs.
Foster grandparent program is another program that the board approved us applying for funding 46 years ago. So we have, that's been a core function of community support services. We have foster grandparents who are considered volunteers. They do receive a stipend from the program, but they are assigned either to elementary, middle schools or pre-K centers.
Right.
And Head Start centers.
Right.
And they are, originally they were kind of rocking babies and just more there for the social activities, but now there's a real expectation of grade improvement and helping children who have issues and challenges to learn in a much more concise manner and really improve test scores. So there are a lot of challenges that they're expected to accomplish.
Let's talk a little bit about housing and the SHIP dollars, what they are, and how you're involved in that.
Sure. We receive SHIP dollars. We are not what's called an entitlement community. We receive an award based on an application to the state. So it's SHIP is state funds, CDBG is another category on there, Community Development Block Grant. Those are passed through the state, and again, we apply for that. Those dollars are used for, mainly for, it's all for housing. Some of it is for housing rehab, some of it is for construction, and in SHIP, the bulk of what we're using now is for rapid rehousing. So what happens is both city SHIP dollars and county SHIP dollars are granted to our social services division, who then in turn places homeless individuals into housing, as well as able to use a portion of that to help low-income households become placed in rental.
Throughout the show, we'll be putting the phone numbers up for people
Great.
who want more information
Great.
on any of these.
Great.
But you mentioned social services, so why don't we move on? That's
Sure.
kind of a broad category.
It is a broad category.
The names of a lot of these things are self-explanatory, but what exactly does your social services division do?
If an individual dies in Alachua County and there's no means to dispose of the body, which is the state term, we have arrangements with local services for that. We also, for the assessments that are out there for solid waste, fire, we are able to review individuals who don't have the means to pay that, and they can ask for a waiver, and we review that.
Oh, okay.
And then we have emergency programs where we assist individuals who are in need of housing. So we can do homeless prevention. So we pay utility bills, rent, mortgage for individuals who meet the criteria and are at risk of losing housing. The other part of that program is to assist individuals who are homeless. We work very closely with our local homeless continuum of care, which is known as the North Central Florida Alliance for the Homeless and Hungry.
And you represent the county on that?
I do. I
board.
represent the county commissioners on the governance board of that body.
Right.
But all of our referrals for services in the rapid rehousing program come through the continuum of care coordinated entry. And right now there is a targeted project where individuals are prioritized who are residing in Dignity Village out at the Empowerment Center.
Good segue into some recent decisions by the County Commission. I know that they are shifting their focus on their part of addressing the homelessness issue to housing, and in addition to their focus, they're backing it up with, I think, what is in effect a doubling of their financial
Correct.
commitment over the next 3 years.
Correct.
Tell us
Correct.
about that. That's both rapid rehousing and permanent housing, is that correct?
Correct, correct.
Yeah.
Our commissioners have definitely recognized that the way to end homelessness is with housing. I mean, that really...
It's the only way.
It is, it is. And the best practice model is based on a housing first approach, so that you identify the individuals, and through this coordinated entry process, it's those individuals who are most in need, most likely to die on the streets. And so we work with those individuals and place them into housing. We work with them to find where they would like to live in the county, look for what they need, but we don't do what historically has done in the past, where you try and get somebody to make sure that they're clean and sober, they're taking their medication, they have income, they're working. In that situation, you're leaving someone homeless on the street and having them accomplish objectives that are just not possible when they're struggling to find something to eat.
And certainly the County Commission has been a very strong supporter of Grace Marketplace over the years.
Absolutely.
I think they just reached a point where the hope is that the city will remain kind of in charge of that area of helping the homeless, and the county is going to keep its focus on the housing model, and hopefully this population will be served better through those two kind of unique efforts. Homelessness is a great transition into veteran services, because I know a number of the people we're working with are veterans, and that's a sad fact that a disproportionate number of homeless people are veterans. We're dealing with the homeless side of that, but we have a really fantastic veteran services office. Tell us about their efforts.
We have a county veteran service officer, and we have 2 veteran counselors who assist the veteran officer. Their basic focus is to assist veterans identify what benefits they may be eligible for, complete applications, and advocate for the receipt of those benefits.
Mm-hmm.
During the course of meeting with the veterans, they look at everything the veteran may need. We have the unique opportunity to have so many services in-house that they can quickly refer to our internal services as well as to the breadth of services in our community.
Just to help them navigate the
Absolutely.
whole landscape of what's
Absolutely.
available to them.
We also work with our housing authorities who have the HUD-VASH, which are housing vouchers that can assist eligible veterans to get housing in apartments paid for with the assistance of this HUD-VASH voucher.
We discussed the Crisis Center, but kind of a very complementary program to that is also Victim Services and Rape Crisis Center.
Correct.
Different division. Tell us what they do.
They respond to individuals who are victims of sexual assault, and we are a certified rape crisis counseling center. We actually serve not only Alachua County, but the state funds us to serve Bradford and Union County as well. We have about 15 staff in that division who are available 24 hours a day, 7 days a week to respond on site. We also are backed up by a team of volunteers who assist us. And the commissioners worked with the UF Health, and we were able to, a couple of years ago, establish a SANE room, which is Sexual Assault Nurse Examiner room, so that individuals who have been victims of sexual assault don't have to sit in an emergency room and be triaged where they may not be seen by the doctors as the highest priority, and they're traumatized and get further traumatized as they sit and wait. We have this SANE room at the hospital where they're able to be transitioned and can be seen much more quickly, as well as be in a quieter place.
And obviously, we work very close with law enforcement
Absolutely.
with this program.
We have several staff who are actually based at Gainesville Police Department, and they also have a grant that funds some of those staff.
Let's talk about, in the time we have remaining, the Children's Trust of Alachua County. And if you can kind of go back to when our county board was formed, up through the ballot initiative, and where we are right now in this effort.
Sure. Several years ago, the commissioners awarded funding to provide services to children aged prenatal to 5. And through that process, they created a Children's Services Advisory Board. That board was formed and it was made to align in membership with the Children's Services Council statute in Florida statutes, anticipating moving in that direction. The board met probably about 100 times over the 3 years
Very
that they were
active.
working.
Yeah.
Extremely active, very engaged, 10-member board. They really spent a lot of time. They commissioned a needs assessment. They reviewed the needs of the children. They identified what programs they thought would most prepare children to be ready to learn in kindergarten, as well as benefit families. So they did spend about a year and a half really reviewing what would be the best. But then they put 3 programs out and asked the community, who were very engaged and attended most of the meetings, the providers, to really come together and collaborate on programs, so that we actually only had 1 applicant for each of the 3 categories. But each application consisted of anywhere from 3 to 5 entities coming together to apply.
Can you go over quickly
Sure.
what those 3
We have
programs
the
are?
newborn home visiting program,
Great program.
which provides any child born in Alachua County, these are not income-based, any child born in Alachua County who is going to be residing in Alachua County, the mother is visited in the hospital, told about the program, and offered a home visit by a nurse within a week.
We were so fortunate that our cameras got to follow that
Right,
process one
right,
time. And
right.
it was a very dramatic video.
It is, that program has actually saved lives. They've
Yeah.
identified some women who were having some challenges
Right.
after medical issues and had to be hospitalized.
And then there's the Child Center, right?
The Child Center comes under the Transformational Professional Development Program, and the goal of that is to they work with the Anita Zucker Center at UF, and they are identifying best practices and improving the skills available and the training available to preschool teachers.
And we just heard a report, I guess at the last commission meeting,
Right.
and
All 3 programs.
the data from that program was impressive, and just the emotional impact of it. What
And
is
that program is being rolled out to 5 other
Oh,
centers.
is that right?
Yes, the training, the teachers.
And what is the 3rd program?
It's
quickly?
social and emotional development,
Right, right.
and that's gears toward behavioral health.
All of this, though, culminated in the 2016 ballot, where the Children's Trust question was on the ballot. And tell us what the Children's Trust is. We're running out of time.
Okay,
but
in
let's get it in
2018, 62% of the voters in Alachua County agreed that we need to do something more for our children, and it provides just under $7 million a year.
And this is an independent
It is an independent
trust,
taxing
yeah,
district.
taxing district. And they, in effect, are going to be taking over
They already have.
of the 3
Their
existing programs.
Their funding began, they began to receive tax dollars with the October 1st, 2019 year, and they hold the contracts.
And I understand they did their first request for grants.
They have an RFP that was out on the street. Their board is right now making decisions on who will be funding, and they've just hired an executive director.
They put the question out there, what is it that your program does for children? And
So
now there's a competitive process.
Looking at innovative ways to address the needs of the 6 to 18, because they did assume the 0 to 5.
Right. That's exciting. We could do another whole show just on the children's stuff. But Claudia, thank you so much.
Thank you so much for having me, Mark.
Great to hear from you.